As the CFO, I will be providing analysis of two rural healthcare organizations to the University of New Mexico Health System CEOs. The two rural healthcare organizations are Ashley Medical Center, AMC, and Pisbo-Scott Valley Hospital, PVH. The analysis of these two organizations will involve a description of the organizations, their financial report, and their credit worthiness. The assessment would then help the CEOs make an informed decision on which organization to merge with. The evaluation of the organization was completed by developing a heuristic. The heuristic addressed 11 criteria, which had detailed factors for what could be investigated as part of the analysis. The criteria included the following aspects: vision, mission statement, values, entrepreneur as in medical supplies and staffing, Medicare and Medicaid insurance, other reimbursement, revenue, financial status, financial stability, and services. After the criteria was defined, each organization was evaluated based on the criteria. And with the heuristic, a financial report and creditworthiness report was developed to further examine the organizations. The financial report included capital expenditures, long-term debt, operating margin, net margin, statement of revenue, and salary and wages. The creditworthiness report then included each organization's balance sheet and their capital plan. From the methods and examination of each organization was completed to give an overview of each organization. The first organization was AMC, and it was found to be a nonprofit community-owned hospital located in Ashley, North Dakota. AMC is previously known as the McIntosh County Memorial Hospital, where McIntosh County has been designated as a healthcare professional storage area. In 1952, AMC opened its doors and has grown over the years into a complex of 20 critical access hospitals, with the capability in the utilizing swing beds, a level 4 trauma center, 44 skilled nursing home beds, home health, hospice, and quality service providers. And AMC has one clinic in Ashley, one clinic in Zeeland, and one in Calm, North Dakota. The medical center also owns two professional buildings. AMC is governed by a public elected board of directors, and their directors have decided that their mission is to provide preventative, curative, supportive, and educational health care that meets the physical, emotional, and spiritual needs of the people they serve. Their vision is to have excellent service in a person-centered environment, which reflects regard and respect for the total good of the patient. Their values involve believing that all patients, residents, and the clients deserve the highest respect regardless of race, age, creed, or disability, and the individualized care of the utmost importance. Therefore, AMC, they have completed diagnostic services including laboratory, X-ray, mammography, and CT scans. They also have contracted services for bone density, ultrasound, and MRIs. They provide services such as WIC, nutrition counseling, physical therapy, cardiac rehab, and telemedicine. These services allow AMC to receive good ratings. However, AMC is trying to improve their ratings by getting the community involved with telemedicine. Telemedicine is a technology that gives AMC the ability to bring expert training and education programs to the community at no charge. It enables interaction between the presenter and the participants of the programs over a network area. In addition to telemedicine, AMC also has 3 recent community education programs, which include stress management, what's new with diabetes, and realities of rural stress. And with all of these services, AMC accepts Medicare and Medicaid. However, if the patient cannot afford any type of insurance, they can offer them financial assistance. And now that we have looked at AMC, let's give an overview of Piscott Valley Hospital. PVH opened its doors in June 1973. And in 1977, a large construction project added 14 inpatient beds as well as a new laboratory, physician's office, and administration space. In 1988, a remodeling project involved modernizing an ICU and converting medical and surgical beds into a 19-bed skilled nursing facility. And they have ongoing renewed remodeling going on at this moment. And with this hospital, their mission is to be the community's first choice in healthcare, known for a culture of compassion, quality, and safety. They also want to be an excellent community partner, working together to improve the health and well-being of those they serve. Their vision is to be recognized by the community, employees, and the medical staff as a blessed place to receive care, work, and practice medicine. Their values is to maintain their culture of compassion and ensure the highest level of patient safety in all aspects of care. In addition to their mission and vision and values, their services include some of the most cutting-edge technologies in the state and new treatment methods. They provide services such as physical, occupational, and speech therapy, and nutrition services. These services earn them the national average of patient recommendation rating with a score of 3 out of 5 stars. And with all of these services, they also accept Medicare and Medicaid. And if their patient cannot receive insurance or cannot afford insurance, they offer them financial assistance through a program called Charity Care. And now that we have received an overview of each organization, it's time to dig into their financials and examine their financial report. Their financial report was developed by defining the capital expenditure, long-term debt, operating margin, net margin, statement of revenue, salaries and wages. After each financial item was defined, each organization was examined based on the financial item. So first we will look at the capital endured. The capital endured for AMC was $1,362,798 at the end of 2014. And as you see here in this graph, which is AMC had a lower capital endure than PVH, and PVH had a capital endure of 6193,248 at the end of 2014. And this tells us that PVH spends more money on upgrading their property and purchasing new equipment than AMC. Therefore, PVH has a higher capital asset that improves the lifestyle of their existing capital asset. Secondly, when we look at long-term debt, AMC had a long-term debt of $21,68952, whereas PVH had a long-term debt of $99,098,207. And with PVH having more liability, it could be noted that the large debt can take many years to pay off. And then it's also to note that organizations with too much long-term debt will eventually find it difficult to pay off because their capital will be devoted to interest payments. So now, since we looked at long-term debt, let's go over to statement of revenue. The statement of revenue for AMC was collected at $149,710, and then for PVH, which had a much higher total revenue, it was $25,145,231. And as you can see, the total revenue for PVH is much higher than the revenue of AMC. And this was contributed to having a higher investment income and a net gain. Moreover, the salaries was broken down into several categories, and AMC had a higher salary for their employees than PVH. Lastly, looking into the financials, AMC had an operating margin of 39%, whereas PVH had an operating margin of 46%. And which is way higher than AMC. And a high operating margin implies that the company is better off at earning more dollars per dollar of sales. And then when we compare the net margins, AMC had a negative 0.077% net margin, whereas PVH had a net margin of negative 3.4%. And from these numbers, AMC is more effective at converting sales into profits. Additionally, AMC has a higher net margin because the organization is more profitable. And from examining their financial report, their creditworthiness for each healthcare organization can also be determined. And this was determined by looking at their balance sheet. And from their balance sheet for AMC, you see the assets is $36.45,760, whereas PVH had a higher assets, which was $13,378,530. And as far as liabilities, PVH had a way higher liabilities than AMC. And so when you look at the assets and liabilities, the capital for each organization was in pretty much good standing. However, AMC, their capital, as in like current ratio, was 1.68, whereas the current ratio for PVH was 134. And when you see this, you would think that AMC has a better capital plan than PVH. So, as I'm getting close to conclusion, overall, both oral healthcare organizations have assets that exceed their liabilities. And their current ratios of both AMC and PVH are above 1. And that means that both of their capital plans are working. However, AMC has a better capital plan. So if each organization wanted to improve their financial situation, they would have to reduce some spending or fundraise or sell some type of assets. So my recommendation for Ashley Medical Center was to sell assets. And the best way for them to do that, when they sell their assets, it would help them because their assets greatly outweigh their liabilities. Therefore, selling more assets would substantially help their financial status. And since their assets is way more than their liabilities, they could probably earn a good amount of money. Whereas PVH, on the other hand, selling their assets wouldn't work as well. They would have to fundraise. And with fundraising, they could probably earn $5,000 because they are already a cutting-edge hospital, and fundraising will bring them more attention. So that's about it. And here are all my references and all the data that I got. So thank you for your time.